The number one question that we are asked at Blodgett Dental Care is, I've been told that I need a root canal. Is that true, and do I have other options? So let's say it is affected, or it's infected, and you decide, okay, I need to do something here. I'm gonna maybe take the tooth out. You could arguably just never replace the tooth. That's an option you could consider. You could, if you're okay with a new replacement tooth that pops in and out, you could make like a removable partial denture, even a single tooth partial denture that literally pops in and out. Another option might be doing a bridge from one tooth in front of that space to the tooth in the back of the space. The upside is it doesn't require surgery in the space where the tooth was removed. However, in most situations, it costs the teeth on either side all of their enamel because you have to grind them down in order to put the bridge abutments on there, which are basically two crowns with a fake tooth attached. And then the last option would be, if you want a tooth that is in your mouth, it chews more like a tooth, it flosses like a tooth, you'd probably look at an implant. At Blodgett Dental Care, we use ceramic implants because it doesn't disrupt the body's energy field quite like titanium metals that tend to corrode. If you have any questions about how this relates to you and your specific oral health and the health of the rest of your body, please feel free to reach out to my team and my new patient coordinators on our website, blodgettdentalcare.com.